Hi, I'm Carolina.
And I'm Amanda.
Welcome to our episode. And this one we're talking to Dr. Zoe. She does our Botox and other little things.
She's our favorite aesthetic medicine doctor in her beautiful office in downtown La Jolla. And we get into the skincare products that you need at home. And then if you want more like injectables and things like microneedling, we break down all the latest and greatest treatments in aesthetic medicine. So enjoy the episode, and we hope you get all your questions answered. Hello, everybody. And today we're welcoming Dr. Zoe Rafaat to the podcast. And I've been wanting to interview her for so long. Welcome, Zoe.
We're finally making it happen.
I have so many questions. All the things people say to me all the time.
Yeah.
About what, just aesthetic medicine in general. I think there's some really funny misconceptions and
totally
a lot of questions. So I want to, tackle all the questions.
I'm excited to share.
Yeah. So one of my favorite things to tell people about you is that you went to Stanford. So let's just start with, because I think it's really interesting that you did anesthesiology. Yep. And so what kind of brought you moving from anesthesiology into aesthetic medicine?
Well, it really kind of started with actually my first Botox experience for myself. So I was 29. I was a resident at Stanford. And an attending of mine at the time had a med spa with her mother-in-law, who was a nurse. She did my first Botox treatment. Obviously, I was hooked on Botox, but I really got to see like, oh, wow, she's like this badass pediatric anesthesiologist. She knows how to do Botox. She owns a med spa. I just, all of it coming together was so cool. And then obviously I got hooked on Botox and, loved it and started dabbling in all things skin for myself. And so it started there. And then when I was in the Navy, and I was an attending anesthesiologist in the Navy, I had a colleague who was also in aesthetics. He started the American Board of Aesthetic Medicine, and he traveled the world. He traveled all over, a lot of time in like India and Europe and Asia, Australia, teaching aesthetics. Oh. And he was my colleague. So at that time, like I had just gotten married, spent a year, planning my wedding, got married, and I was bored out of my mind. And I was like, I think I'm going to learn how to do this. Yes. And set up a little side hustle, like passion project. So that's kind of how it started. And then when I had my son in 2014, I was doing anesthesia part-time and really just not loving it anymore. So that was like the pivotal time for me where I started to shift, doing more aesthetics and like focusing more on aesthetics and less anesthesia, and really kind of falling out of love of that environment that I was in the hospital.
And where,
basically,
right. Where did you get the Botox? Like that very first time, if you don't mind me asking.
Totally. I love that question because I have the same Botox rep today that I did in 2011, which is so cool. So you basically call up Allergan and you set up an account. Obviously you need a medical license, which I had that.
Well, what's the number?
I had that going for me. And then your local rep like reaches out to you. And so at the time, I didn't have a lot of clients. I wasn't doing a lot, it started with friends and family and that sort of thing. Yeah. So I would order one vial at a time, 100 units.
That's a lot. Kind of.
Like it would be enough for like a few people. So it would last me, for a few appointments. And then I would like order my next vial and it would come overnight on ice from FedEx.
Wow.
I don't know if you remember the pharmacy that was in La Jolla. What was it called?
Ernst Judd's.
Yes. So I like had an arrangement with the pharmacist there because I didn't have my own office space. I was working out of someone's facial studio. And so he would accept my drugs for me.
Funny. So when you were at Serena's, like on Faye?
So, no, not Serena. So it was Amy. Do you remember Amy M?
Yes.
And the little like oceanside, like
That's
room up on the second level.
Yeah, because it's also cool to hear, because you're also very much a female, like a woman business owner, and you just steadily grew into like a bigger and bigger space. Like, tell us a little bit about that journey, because just as you know, it's a pretty cool, steady climb you made over time.
Well, it was over a lot of time. It was slow, and I think that's what's cool about it. I didn't really have the pressure to like go big or go home like right off the bat. So I think I was just able to just be really organic in my growth and take my time, because I did both specialties for a few years, and so I didn't have that pressure. So I worked out of someone's studio for a while. And then when my son Arrow was 2 years old, I got my first brick and mortar on Faye Avenue. It was 150 square feet. And it had a cute little Dutch door, and it had a little swing outside. And I basically was just doing like Botox filler for the longest time. Like that was pretty much it. Then I started doing microneedling and kind of growing my treatment options and menu and things like that. And I outgrew that space in like 3 years or so. Then we moved over to Herschel near Burger Lounge. And I think I had one nurse practitioner that was with me at that time. So because I had my second child, I had to go out on maternity leave. I needed someone to like take care of my clients. So that's when I like brought someone else in. But before that, just kind of did everything on my own. So
that was like a big jump. At least from the outside, it looked like a big jump.
Huge jump.
Yeah.
Huge jump. So with another person, and then it all like goes from there, right? Because with another person, then you need more supplies. And then I did need a little bit more space to like store our supplies. So I got a second little room like down the block to like house our inventory and syringes and stuff like that. And we just outgrew that setup pretty quickly, her and I. So we moved to Herschel, and we had like 1,200 square feet, which was huge.
Right.
And did a big renovation there and got to just really build something beautiful that I loved. And did it full time pretty much there. I wasn't doing anesthesia anymore at that point. So that was a big shift too. First time I really needed I have a huge leap of faith. First time I really needed like a front desk person, we needed another phone. Like it was just, everything just happens, and then we were in that space for a few years, and we were outgrowing that space. So last year, we're almost 1 year in our new space on Girard, which is 5,000 square feet, and it's still crazy.
It's fantastic and amazing. Yes, and gorgeous and welcoming. I love everything. It's a special place. Your places have always been to me, like, of course, they're clean and they do feel like, a medical establishment, but it's so loungy and the vibe is so feminine and it's soft and comfortable. So it doesn't feel like overly clinical, which is, I've just always loved that about all your spaces.
Thank you. Yeah. I mean, I think, coming from the hospital and just wanting something so different than that environment, I really did want to create a place that didn't feel medical. I went from Dr. Rafaat to Dr. Zoe. I wanted it to just be, just like make people feel welcoming, warm, homey, just like more homey, less medical.
It is more homey, even than other med spas, which are so beautiful, but they just feel more like white and glass, whereas yours has that like big warm hug feeling.
Yeah, I love that.
It's amazing. So you have a skincare line, and it's my favorite skincare line. I've been using it since you had it. So however long that is. And my skin was always dry. And since I've been using like my, what do you call it?
I call it a lineup.
My lineup.
Yeah.
My skin's never dry, and it's never looked better. So I
Agreed.
love and highly recommend your skincare line to everyone. And I know it depends on your skin, but what are your like 3 to 5 must-haves in your skincare line?
Okay. So typically, if you're in the age range of like proactive aging, right? So you're late 20s to 30s, you really want to preserve your skin quality. I typically recommend like an active product in the morning and an active product at night. So actives are like the ingredients that really change the skin at the cellular level, right? So cleansers and like hydrators are good. Hydration is great, but like those actives are the components that are really going to change your skin. So in the morning, I love our advanced X6. So this is a pad that you swipe over the face. And it has 6 stabilized acids, so tranexamic acid, glycolic, TCA, a few others. And it's amazing for really gentle exfoliation, brightening, helps with texture, pore refinement. And it's a great way to, it's a great like first step of the day. And then, you know, your serums or whatever after that. So I love X6, and it's great for almost every skin type and concern because of the properties and the combination of the acids in there. So like acne, you know, proactive aging, texture, discoloration, scarring. I mean, it's good for everyone.
I think I need to like re-up on that.
Yeah. So I love that one. Love, love, love. And then evening is a great time for retinol because at night your skin's in repair mode. And so retinol increases skin cell turnover, stimulates collagen. So that's really the time you want to focus on retinol. And if you're not pregnant or breastfeeding, in my opinion, once you're 20 something, you should be on one. Because we start breaking down, our collagen starts breaking down in our 20s. So
yeah, I got like wrinkles. I mean, I started getting fine lines like 28, 29.
Yeah. So we just launched in our line new retinol. That's incredible. It's called Skin CEO.
Oh, yeah.
And it's a beautiful formula with retinol, 1% retinol, all trans retinol, and plant-based exosomes. So it's really powerful, but it feels really decadent on the skin, which most people will not say about their like prescription tretinoin.
Right.
Most people can't even tolerate prescription tretinoin. So you can use it every day, which is going to translate into actual benefits and changes of your skin. And it's kind of like a no drama retinol. It's not going to do all that bumpy road, you know, beginning stuff that other retinols can and that tretinoin typically does. So it's incredible. And then I think you use the One Serum.
I do. I love it.
So that's one of our top products, and so great because it's really that kind of supportive serum that you can layer morning and night. It's snail mucin growth factor, 24 karat gold, really amazing properties to support the skin with those actives. Anti-inflammatory, antibacterial, hydration, all of that. So I would say those are my top 3 products, just packed with powerhouse ingredients. Not a lot of fluff ingredients in our line. Like less is more. It's all very targeted. Everything has a purpose, and it's very clean.
Yeah, and I love the way it feels, and I love not having to worry about going anywhere else. You know, I don't know, like I see some of my friends and they have all these different things from all these different lines. And I'm not saying it's wrong. I'm just like, you don't.
It's exhausting. I'd rather be on the hunt for like jeans every day than skincare.
I am on the hunt for jeans every day.
Me too. But like, yeah, I mean, I'm with you. Like, I think we've had the line for 7 or 8 years now, and I do not stray from my lineup. ever. And I'm not influenced by products. Like I just literally don't even care.
It's actually relaxing.
Yeah.
And if I do use, like maybe I'm on a trip or I'm at a friend's house, I really appreciate that. And maybe I'm wrong, but like, it doesn't seem like you use any fragrance.
No fragrances. In our line, there's no fragrances.
I really like that. I don't like rubbing fragrance on my skin. I'm not even trying to do an anti-fragrance campaign right now. I just like, I appreciate it. Like you said, it just feels really clean and like it just has in it what it needs to be. Like
a couple of the products do have a natural aroma, like our vitamin C serum, C Glow does kind of have like a natural aroma. The toner has glycolic salicylic niacinamide, and it kind of has a little natural aroma that's pleasant. But yeah, I mean, you don't like wear perfume if you want to have a scent.
Yeah, I think it's like meant to make it feel more luxurious or something, but I just feel like I don't like it. And I just love that yours does not have fragrance. And then, so if someone wants to figure out what's right for them, like how does someone go about like getting their lineup?
I try to provide a lot of information on our website, which I know can be overwhelming for people. So I'm also always putting it out there on social media and on our product pages. Send me an email, like send me a DM. Come into the office, have a complimentary consultation. All of our providers here are also users of our line, so really understand how to pair the products and the ingredients. So it can be overwhelming. We also have a page on our website called Lineups. So they're sets or bundles of products that are targeted for certain skin concerns. So for example, there's like a Get Clear acne lineup. There's a Let's Glow, trifecta lineup. There's a Safe Mama. So like ingredients that are safe for pregnancy. So those can kind of give you ideas of how to pair products together. But I'm here, like I love helping people with skincare. I have people send me photos and we talk about their concerns, and we can do it all virtually. So it's easy.
That's great. Yeah. And I always say, like, at first when you buy all the things, it feels expensive, but you never run out of everything at the same time. I'm always like buying one here, one there. And it's like, it's really not that big of a deal. And they last. It lasts.
They last. Yeah. They do. They do last, and less is more. So when people switch to our line and they come in for that like first refill and they're like, oh, this only lasted whatever. I'm like, well, how much are you using?
Right.
Like you don't need like a glob of moisturizer. Like it's very small amount, less is more.
It is true with your stuff. I do. Sometimes I just feel like slathering,
Yeah.
Like the one serum I need to chill on. Like every time sometimes I put it on 3 times a day. I just feel like it's the ultimate, like, after I wash my face, I don't know. I just want that on it. But it just need a little.
Small amount. Yeah.
One thing I feel like when I'm talking to people, and maybe because I've been getting Botox so long, I'm so surprised that people...
I love that you're sharing that information.
I don't see... That is not a secret. I don't keep any of that a secret. In fact, I really need some Botox. But it seems like there's a lot of confusion between what filler is and Botox is. Like, my husband, for example, is like scared of me going overboard or whatever, and he'll see an example of what he thinks is too much, which what I think he's seeing is filler, and he'll be like, oh, they've got Botox all over the place, and I'm like, you don't know what you're talking about. I mean, he doesn't really need to know because he's not going to get it, but I do think that seems obvious to us, but like if you could explain the difference.
I think a lot of people are still confused and probably will always be. But Botox and filler, the similarity is that they're both injected with a needle.
Right.
They're both temporary. So other than that, they're super different. Botox works on muscles. So it works in the nerve terminal between the nerve and the muscle, and it weakens the muscle. So it provides softening of dynamic wrinkles. So when you're raising your eyebrows, you're frowning, you're smiling, it's for that. And it can do other things, but we could do a whole podcast on Botox.
Right.
So that's kind of the gist of Botox. It also is really good for prevention. So in minimizing the strength of the muscle over time, you're going to prevent lines from even forming, or you can prevent, like, I know when I met you, you had a pretty deep frown line.
2 of them.
And you've been consistent, 2 of them. So, and you've been consistent for like more than a decade. So you don't really have that anymore. So that's that preventative aspect of Botox, which is so great. And then filler is hyaluronic acid gel. So we have hyaluronic in our skin. It attracts water. It's what makes our skin, plump and moist and all of that. So fillers are generally hyaluronic acid gels in syringes, and they can be used at different depths in the skin. So they can be used really superficial to boost skin quality. They can be used a little bit deeper to minimize like deeper folds. And then they can be used even deeper, like near the bony structure of our skeleton to mimic, fat pads and bone that we lose over time.
Like where?
In the cheeks, in the jawline. These are often areas where it's deeper and it's providing more support, more contour, more of a lifting effect. So that's really the difference. What people are seeing out there as like bad Botox or bad filler, like your husband who's probably just seeing filler, that like overfilled syndrome, right? I think filler gets a really bad rap because of this look, and that doesn't happen in one treatment. Like that is happening from multiple treatments over time, from very likely an injector who doesn't say no, who isn't evaluating facial harmony, balance, and all of that, looking at the bigger picture. So it's just, that doesn't happen in one session. And I think filler really does have a good role in like a proactive aging plan. So it nothing does what filler does. So it is helpful as we get older. So it does have its place.
And like, what if someone comes to you, and I don't even know if this happens, that is maybe already overfilled or would like to be overfilled? What do you do about that? Just because they might be like, I went to Dr. Zoe. I mean, I'm sure there's a lot of reasons why you wouldn't do it, but what do you face that situation, and like, what do you do?
Certainly we face it every now and then, but I mean, thankfully we do have a more natural aesthetic in general. And so most people aren't coming to us like seeking a result that's overdone or overfilled. But I think when someone does, sometimes it's really losing sight of the bigger picture. Like maybe someone's perseverating or hyper focusing on like this bold, where, they just keep getting filler in this one area. And it's like, hold on, like, let's look at your whole face. Let's see, let's go through big buckets of aging. What we lose collagen, we lose fat, we lose bone. Like, let's be systematic in our approach and what tools we're using. So I don't know. I think people don't come to us for that. So I'm so lucky I don't have to do that. But I talk people out of filler quite a bit, so yeah.
Yeah, I mean, that's one of the many reasons I love you, is I know you've got my back.
Yeah.
If I ever go down that road.
We're not going down that route.
No, I'm not going down that road. And I do think like you really give this natural look.
Yeah.
Like I have a friend who shall not be named who just got lip filler, and man, does it look good.
Love that.
It does. It looks gorgeous.
Love that.
Yeah, I mean, I guess that is my next question. Like, you are known among all my friends, among La Jolla, as like creating a natural looking aesthetic. What is your philosophy or approach that helps you achieve this? Like, how'd you learn how to be like that?
I think it's what I want for myself.
Right.
So I mean, I've been doing treatments since I was 29. I just turned 45. I think I look good, pretty good.
Agree.
And I've done it all. I've done thread lifts, I've done filler, I've done sculpture, I've done everything. So I think I want that for myself. I want people to have the confidence in their outer beauty. I want them to feel like the best versions of themselves. I think that's really the most important thing.
Yeah.
And knowing when to say no.
Yeah.
Is important because people do have dysmorphia of the face.
I think that's the word. I mean, that's what I was looking for. And it's a thing.
Yeah, it is a thing. It is a thing. And I have very few clients that I can think of that, are truly, truly dysmorphic. And they're so beautiful.
Right.
They're so, so, so beautiful, but they don't feel it. So they're looking for something, and I just try to be honest with people and tell them what I see and try to get them to see what I see.
Yeah. And I think it's great. Like you do all the things you offer, at least you've tried it or you're really aware of like what it does. Yeah,
absolutely. So
when we get into these, beyond skincare, beyond injectables, or maybe it includes injectables, what are your like top 5 most effective treatments, beyond skincare that you recommend at your office?
I mean, Botox isn't for everyone, but I have to put Botox at the top of the list.
Why is it not for someone? I'm just wondering.
I mean, some people are just, they don't hesitant. I think what it is some people just are not educated on what it is, what it does. There's so much like rhetoric out there on social media.
I just saw something really.
And most of it is just so absurd and insane. Yeah. Like, the facts are that Botox is extensively studied. It's been safely used for 30 years.
I think longer, right? Since the 80s.
Yes. So since the 80s.
We're moving into 50 years.
We're moving into 50 years. Okay, that's crazy.
Right.
And it's complete. What people don't understand is it's not a one size fits all.
Right.
You do not need to be frozen face. It's completely titratable. The results can be supernatural. You can do it once, and if you hate it, never do it again.
Right.
I mean, that rarely happens. But yeah, I mean, there's still hesitation about it, but I do truly, truly believe that the preventative nature of it and the benefits there are just hands down, it has to be done.
I mean, when I have a friend who doesn't want to do it, which is totally fine. Like I do it because of what I see and what bothers me, and I want to fix it, and that's my business, and I don't ever judge anyone else's face. But they'll be like, I got this cream for the wrinkles in my forehead, and I'm like, just set your money on fire. Like, it's not good. I mean, that doesn't work. Yeah. I mean, I know it does when you put it on, and it's great to be hydrated and all that. Yeah. But like, if you don't want wrinkles in your forehead, I think there's just one answer.
Yeah. I mean, I tell people that all the time. I'm like, nothing does what Botox does. Like nothing does. So yes, you can do creams, silicone patches, facial massage, red light. You can do all that.
Right.
But nothing will do what Botox does. Nothing will. So I really think it should be a cornerstone. And at the same time, when people come into me and, it's their first time and they're exploring options, I'm also like, just here's the information.
Yeah.
It's your choice. I'm kind of sounding pushy right now, but I'm truly not. Like,
no, you're not.
To each her own.
Yeah. Like, remember, I just wanted it here.
Yeah.
And you were like, just so you know, you know, and you gave me the reasons why I should go more, and I didn't want to. And my friend Kira was like, Amanda, you have like a stamp of no wrinkles here. And
that's
the rest, and I was like, okay, I'm ready for more.
That's right.
You have to just
vividly
go through your own.
remember that. Oh,
So yeah,
I love it.
Botox is
So Botox is like number one cornerstone. I think it's the best. I love, and our clients love microneedling. Microneedling is another well-studied, research-backed, 30, 40 years been in use. Obviously more popularity in the past like 20 years probably. But it stimulates, call it 400% stimulation of collagen compared to untreated skin. So you just can't get that in anything else. It's been proven to have equivalent results to lasers for like acne scarring and texture. It's really easy downtime compared to other treatments that have similar results. So in that respect, it can be done on a regular basis, which is going to give you that long-term change in your skin. So microneedling for sure is up there.
What do you think, like 4 times a year or more?
I think it depends on your age.
Yeah.
So I think even in your 20s, I think you could do a microneedling or 2. I think 30s, to 50s. I think if you're really serious about keeping your skin quality up and preventing signs of aging, like 3 times a year, I think is really good.
Okay.
And it really is a cumulative effect. It really is kind of like Botox in that way where one treatment, okay, fine. But like that maintenance schedule is really gonna get you to like halt the signs of aging. I mean, it's good for skin tightening, texture, pores, fine lines, brightness even. So it just does it all, and it's good for every skin type, which some lasers and devices aren't.
Right.
So like darker skin types can have some higher risks with heat-based devices. So microneedling just kind of does it all.
I love it.
Yeah, I love it too. I mean, I swear by it. I've been doing it regularly for so many years.
And it really is like, I mean, I peeled a little last time, which I actually love, but
Yeah.
the very next day, your hat and the sunglasses, but just to keep the sun off. Like it's really not that much of downtime.
I mean, I did it last week and I'm peeling today, and I was wondering if you were going to be able to tell in the video.
No, you can't. You look glowing.
Yes.
And then I feel like there's all the little add-ons with the microneedling.
Yeah.
What is like your favorite too?
So we call them skin boosters, and they kind of pair with microneedling, and they're in generally like serums that we use to kind of get deeper into the skin with the microneedling device. So microneedling can actually increase penetration of anything that you put on the skin by 3,000%. So that's huge. So all those ingredients topically that you pair with microneedling are going to be so much more effective. So vampire facial, which is PRP, and microneedling is pretty popular.
Wow.
That uses your own blood, so it's super natural, uses your own blood's capabilities for regeneration and things like that, repairing, wound healing, and more benefits for everything. So I would say vampire facial is great. We do have exosomes now that we pair with microneedling, which is also really awesome.
I did that. I really feel like I could tell.
Yeah.
Like it was a little bit off from just regular.
Right.
Yeah.
And regular is great. That's the other thing. It's like regular is great, but if you can, we can take it even more like next level. So I love the exosome booster. It's a plant-based exosome, so it's just really, it's amazing. And then Lume Envy is really popular right now. So Lume Envy has the salmon sperm ingredient, PDRN.
Yeah.
Combined with glutathione, which is a great antioxidant, vitamin C, and niacinamide. And we're seeing really amazing results with people that have more hyperpigmentation issues. So extensive sun damage or melasma, and even getting improvements with melasma using that booster. So that's been really cool. That's one of our newer ones.
Nice. I want them all. Yeah. And then just a few more treatments beyond.
Yeah. I would say, filler, like I said, has its place. So I love filler. And then Sculptra, so biostimulators, which is what Sculptra falls into that category.
So what is that like? Because I've been hearing a lot about Sculptra, like, and I've heard it's like, oh, filler for your whole face. Like, I mean, that's just something I've heard someone say.
That will probably scare everyone away.
That's why I was scared. So what is it and what does it do?
Sculptra is a biostimulator. So it's a material that it's a powder of PLLA. So it's a PLLA powder, which is kind of you can think of it like a suture material, right? So when you get stitches or something like that, that kind of like absorbable type of material in a powder form that we mix with sterile water. So it becomes a solution that we inject in the face, mainly the lateral sides of the face and kind of this zone here. And basically what it does is it stimulates collagen and elastin. So over time, you're getting skin tightening, a volume to the skin, kind of a plumpness. And then when it's used kind of in this more lateral zone, because when you're in your 40s and such, you start losing volume back here. So you notice that if you have little like wrinkles by the ear, or if you have a big drop off under your cheekbone, this zone has lost volume. So we use filler in that zone. And when you do, you get a central improvement. So you get like a skin tightening effect. And it's super natural. It's very gradual process. It takes time. So 3 to 6 months from Sculptra to see results. And then you do need multiple sessions kind of for your optimal result. But one way to think of it is kind of like a 401k investment plan for your skin, because you're laying the Sculptra, right? You're like putting in the funds and then it like pays off over time.
And so like, do you start with 3 sessions?
It depends. It depends on what areas you're treating and how much, skin elasticity is present and stuff like that at baseline. But 3, I for someone who's like 40s, I would say 3 to 4. Typically.
And then how are those spaced apart?
Usually like 6 weeks, 6 to 8 weeks is good timing. And then I love to see people back like 3 months after their last vial. And that really gives time to see the effects. So if you're one who's like, you need that instant gratification, you have an event, you're, looking for that really immediate effect, like Sculptra, isn't for you in that moment.
Right.
It's definitely a more gradual process. It's super natural. It does improve the quality of the skin and the actual glow of the skin. And that's like on label, like FDA approved for glow, which is super rare.
Wow.
Yeah. So it's great.
We should say that it does.
Yeah. So it's great. I love Sculptra. And then how many is that? 1, 2, was that 4? Is that 5 yet?
That's 3 or 4. Like threads. I think people are scared of those too, maybe, but they seem to really work.
Thread lifts definitely work. They are not a facelift. They are not, surgical level results. But I really, really love thread lifts for someone who's like late 30s to early 50s. That's like the sweet spot where the skin still has good elasticity and you have fullness, starting to happening. You have that sagging, because what thread lifts are able to do is literally what we all do in the mirror, like this. That's what it does.
Yeah. And how long does that last?
So that can last, realistically, it's about a year, and it can vary, but about a year. And I've had 3 thread lifts in like the past 5 or 6 years, and I really, really like the results.
Okay, give me one more of your favorite go-tos.
Okay, so the last one, not necessarily for the face, more for body, but laser hair removal. Laser hair, being hairless is like such a life hack.
Totally.
Such a time saver.
I shave things every day.
how many minutes is that of your life?
I don't know. And like the laser makes your skin so smooth.
Yeah. So I would say laser hair removal. I mean, it's a investment, a time and, money investment upfront, but it definitely pays off. It doesn't require that much maintenance. And I think, that's a life hack right there.
And isn't that like old tale of dark hair not being laserable? That's not true anymore, right? Or it's less true?
So dark hair is the target for the laser hair.
Then it was,
but blonde hair cannot be targeted.
Oh, for some reason I thought they figured that.
So like the peach fuzz and that whole thing is still got to do like dermaplaning or, something else for that. But the laser hair is awesome.
Laser hair. Yeah. And then one other thing I just hear so many people talk about this is your aqua gold facial. Like that, the event facial. I almost facial.
Yeah. Yeah. People love that one because, whether you're like pre-vacation or pre-event, it's super minimal downtime. It does have peak effects in 2 weeks. So you need to like plan a little bit for that optimal result. Yeah. But that involves kind of a cocktail that we customize, and it has a little bit of Botox, a little bit of filler, skin brightening vitamins, and we can tailor it. But then we press it into the skin with this little device that has a bunch of needles, and it goes at a fixed depth, super shallow. So all those ingredients are just in the superficial layer of the skin. So it really helps with like skin boosting, skin quality, glow, a tightness that you can't really get from anything else that quickly.
Did you?
And a hydration. Yeah. Like the hydration. Yeah.
And did you like make that up?
No, but I feel like I was one of the very first offices in La Jolla to have it because it's super popular in LA.
Got it.
I've been offering it for a while, but people will call it like the red carpet facial or the Botox facial. Aqua Gold is the name of the device that we use. So it can also be called microchanneling or microinfusion. And it's basically that concept of infusing the ingredients at a fixed depth, just very superficially. So that's a really good one too.
That is good. I mean, you've got a lot. It would take us all day, but
truly.
And I'm a huge fan of the microneedling.
Yeah.
Love it.
Yeah.
Do you ever have people who have like maybe unrealistic expectations, wanting things to turn out a certain way that's just, not possible, or a little like they're not quite understanding what's really going on? Like, how do you handle stuff like this if you face it?
Yeah. I mean, I think that happens, and I think people definitely can have some unrealistic expectations just because everyone's on social media, everyone's getting bombarded by some misinformation, some good education, but it's a mix. And so people are confused when they get here.
Totally.
So, I mean, I think for me, it's just honesty and really just laying out truly what are the realistic expectations. And making sure that people are prepared, not just for like their results, but like the downtime of treatments. I think people don't really understand either. And I always would rather people are over prepared, and have an easier time, but they know what to expect. Like the number of times I've had a client come from an outside office who like had a treatment and had no idea what they were in store for after. I think that's so, like, I don't know, that just is uncomfortable for me. So I want everyone to know what they're having done, what it's going to be like. I try to really, really, really cover all the bases, and so do my other providers here. So I think that's really important.
Yeah, you are really good at explaining, what's about to happen and what's going to be, and you get like follow-up emails. But I do feel like, I think with doctors in general, I think people forget to ask questions. And then,
yeah, for sure. They forget to ask questions, or when you're giving them the information, they're kind of not really keeping it in there.
That's true. That's very true.
Yeah. So yeah, we'd send, follow-up information and all that. But I just want people to be prepared.
Yeah.
And to know what they're in for. Like, it doesn't serve me to do a big treatment on someone and then have them upset or, shocked that their skin is falling off.
Right. And just to not, I feel like you guys are really good at not overselling, over promising results. And maybe that happens sometimes. And just a lot of industries, a lot of wellness industries does that too.
Yeah. Unfortunately.
Anything like emerging technologies or treatments on the horizon? I feel like this industry is always coming up with new things. Anything you're excited about or maybe wanting to test out soon?
This industry has so much just growth, development, and it's so exciting. I mean, it's come so far in the 14 years that I've been doing it. I'm really interested in the whole regenerative space and kind of biostimulators, exosomes, peptides, and this whole kind of really changing the skin at the cellular level, not just throwing something on there that's going to like plump it up. So I love that. And I think that niche is really going to grow a lot over the next decade. So I think who knows where we'll be in 10 years.
I mean, peptides, I don't understand them exactly, but I sure do listen to a lot of podcasts about them. Like taking them internally. So do you think that it'll be like maybe something topical? Or
peptides are in skincare, right? I mean, peptides are just very simply, they're amino acids, so they can be building blocks. They are building blocks of proteins. And when it comes to skincare, proteins that we care about are like collagen and elastin. Right. So
those are peptides.
That's what peptides help support the growth of. Yeah. So they definitely are already in skincare and will be, forever. But I think there's just a lot going on there with more nuanced kind of regenerative things. Yeah. So I think that's going to be exciting. Yeah.
And how do you like stay on top of what's new and happening?
I mean, I go to conferences.
Yeah.
I do different webinars and things like that for sure. Yeah. So, I mean, in the way that like any field does, it's continuing education. I do a lot of continuing education for myself and my providers. A lot of it is just behind the scenes. It's what we have to do to stay up to date on everything.
Yeah. That's awesome. And
go ahead.
Do you have, it seems like when I'm in there, you have like an all-female team.
We do.
And how do you like working with all women and having an all-female team? I mean, I'm almost always worked exclusively with women and I love it. How do you?
I love it too. I mean, I feel so lucky to have this group of women that we have now. We have probably 12 or 13 people on our team.
Wow.
And, with that many women, it could be bad, but it's not. It's like, it's empowering to be around so many creative, strong, independent, caring, loving people. And I just feel really lucky to be here with these women. I mean, there's a lot of emotional intelligence in this building. So I think that this kind of, translates into how we care for each other and how we care for our patients. So it's awesome. I mean, it's the best. Yeah.
And it speaks to you of being a good leader.
Yeah. I mean, I've never been a very hierarchy focused person. Even when I was in the Navy, I would cringe when people would call me Lieutenant Commander.
I'm going to start telling you that.
It made me so uncomfortable and just didn't feel right. And I think I'm the boss and it's my business and all that. And, there's people at varying roles and levels, but I really just feel like we're all one and everyone has a voice. And I love when people speak up. I mean, I've learned all this business stuff as I go. And so a lot of people know more than I do. So I'm open for it all.
That's great. It feels like that when you're in there.
Yeah.
Just a warm, like team family
Yeah,
vibe.
for sure. Yeah.
Is there any like common misconception that we haven't covered about aesthetic medicine that you would want to address? Maybe not.
I think, I think one big one is people think results have to be super dramatic, or like major transformations, but like sometimes those subtle ones are like really where it's at, sometimes the best aesthetic work is invisible. So
yeah,
it's, I think that's one thing. And I think the other big one is really people think aesthetics is just all about chasing vanity.
right.
And it's really not. It's really about finding confidence. And I think that's so important in how we, present ourselves in the world, is feeling good about how we look. So I think that's a big one.
Yeah, I agree.
Yeah.
There's no shame in it. I don't think if you don't want to share what you do, that's fine. But I've never felt that way. I mean, I did hide it from my husband for 15 years.
Yeah.
And then finally told him.
Yeah.
And
wait, does he know that you did it for 15 years before? Or does he think you just started?
It was like a lie of omission. I guess that's what those are called.
Yeah. Yeah.
And in my mind, I was like, it's none of your business. What I shoot into my face. But I think for me, he would say things like, not in a rude way, but just maybe commenting on women and aging. And I could just see that he didn't understand the reason I didn't have wrinkles was not because of my lifestyle. I'm just like, let me break this down for you.
Yeah.
I would have deep, deep lines in my forehead if I didn't have Botox. And I don't want those lines. Nothing against, I don't want to make other people feel judged.
No, totally.
I didn't like them. So I just finally felt like, this dude needs to know what's going on in the world when it comes to this topic. So I think I told him that I feel like I was one of your first clients.
You really were.
Yeah.
And really were. When you were doing all that Thai massage, I think I came to your massage studio a couple times.
Yeah.
Yeah. Yeah, for sure. I mean, I think the number of people that are still like hiding it or ashamed of it is really not a lot anymore.
That's true. Great. I openly talk about it with friends. I don't think anyone really.
When I first started, nobody talked about it.
I agree.
Nobody.
Yeah.
So, but we've come a long way.
Yeah, it's great. It's good. Yeah. Thanks. I think and partly to you. Another really cool thing that you have going on at your place is this new Her Wellness consulting service with Dr. Valerie Gafori. We have had her on the podcast about perimenopause and menopause.
I loved that podcast.
I mean, that was so good.
So good. It's like everything in a nutshell.
Yeah. And I do everything in a nutshell. Like people, I feel like it used to be like, oh, no one talks about menopause. And now I feel like it's all anyone talks about. And maybe because I'm 47 and I'm paying more attention, but I almost feel like we've veered into like, there's now a lot of misinformation and wacky products, like shampoo for menopause. I'm like, really? I mean, I don't know. But
it's almost like mirroring like Botox, like, right? Like what we were just talking about, like Botox 10 years ago was like so taboo.
Right.
And now like everyone's, talking more freely talking about it.
Which is great.
But right. And so I feel like with this, it's kind of the same thing. Like I noticed in the past like 5 or 6 years with the women and the conversations that I have all the time, people were talking about it, talking about their symptoms, talking about their experiences with doctors who like didn't know how to help them or didn't know what to do or were like had this misinformation. And so they were like still suffering through it. And so that's kind of how the Her Wellness Clinic was born, because I was having these conversations and just thought, this doesn't have to be this way,
Right.
And I know Dr. Ghaffori, and she came around to the same idea around the same time. And it's been amazing having her part of the office and helping so many women.
And she's really just such a good source for not only, being able to talk to her about what you're going through and her understanding, because she's there, I think.
Yeah.
I don't know, was she early 50s, but yeah. And I just feel like there is all this information coming at women now about it. And I feel like her viewpoint and what she's using for treatment is right on. It's no extras. It's really what you need and straight to the point. And I think it's so exciting that you're offering that there.
Yeah. Yeah. It's amazing. She's such a gem. We're so lucky to have her here, and just our community is lucky to have access to her. Absolutely.
And just this big space you've created, and having, something like that there, and all the other things you offer. It's really, really cool, dude.
Yeah. It really kind of rounds everything out.
Yeah. It's been really awesome watching you grow your whole situation, because it's more than a business. It's very, very cool.
Thank you.
Yeah.
Thank you. Love it.
Thanks for taking the time to talk.
Yeah, absolutely. This is so good.
Yeah. And just to so everybody knows, if you're in La Jolla, tell us where you are and everything about your place.
Yeah. So we're in the Art and Design building on Girard. And yeah, we take the occasional walk-ins and have the availability to do that. We also have an amazing esthetician here. So we do incredible facials. We do IVs. We have Dr. Ghaffori. We have it all. We're open some Saturdays. We have Thursday late night appointments. So yeah.
Come on down.
We're on the block of Floral Palette. And that's a good stop too. Yeah. In there, and the bakery. So yeah.
Nice.
Yeah.
Well, thanks, Doc.
Thank you. Thanks, Amanda.
Yeah, that was great.
So fun.
And we'll share all your info on our site with the podcast. And
okay, great.
I'll see you soon for some Botox. Well, that was a great interview. Thank you so much to Dr. Zoe for taking the time out to talk to us about all things aesthetic medicine.
And stay tuned for our next podcast. We are bringing on Dr. Sarah Winter. She's our favorite dentist, and we're going to talk about one of my favorite topics, teeth.